discuss about the brain dissection. My name is Anas Ibrahim Yahya from the Department of Anatomy, Faculty of Basic Medical Sciences, College of Health Sciences, Bayer University, Kano. Basically, we all know that brain is one of the most important organs in our own body, and it is generally located within the cranium. And we know that brain is mainly divided into two parts. We have what we call the larger brain, which is consistent of the two cerebral hemispheres, one on the left side and the other one on the right-hand side. We also have a smaller brain, which is the one we call the cerebellum. And so the cerebellum is just lying below the two cerebral hemispheres. And as we all know that the two cerebral hemispheres, one on the right side, one on the left side, each one of them is made up of 4 lobes. We have what we call the frontal lobe, we have the parietal lobe, and then we have the occipital lobe, as well as the temporal lobe. And these are all demarcated by various fissures and sulci together. And so if we also want to delineate the poles for the cerebral hemispheres, we can say that each cerebral hemisphere is made up of, or it consists of 4 poles. We have what we call the anterior pole, which is present on the frontal lobe, and then we have the occipital pole, which is the highest peak on the posterior lobe or the occipital lobe, and then we also have the temporal lobe. Temporal lobe can easily be seen here on the anterior side of the temporal lobe here. So basically, we can say that we have 3 important poles, and then we have the most superior one, which is on the parietal lobe itself. So basically, we can say that if we now have a look at the two cerebral hemispheres, they are basically united together by a bundle of nerve fibers, what we call the corpus callosum. And this corpus callosum is basically made up of a white matter, the axons of the neurons that interconnect the two cerebral hemispheres together. And so we can say that the two cerebral hemispheres are not somehow separated together, but they are linked together by these bundles of corpus callosum. So let us just look at the cerebral hemisphere itself before we now go and dissect the cerebral hemisphere and the other structures that are within it. So if you now look at the superior lateral surface of each of the cerebral hemisphere, we can see that we have so many convolutions as well as depressions in between the convolutions. Each of these convolutions is known as gyri. Somebody can pronounce it, or they pronounce it as gyri. And so in between each of these gyros, singular gyros and plural gyri, and so in between each one of them we have what we call the sulci, or sulcus, singular sulcus, and then the plural we call them sulci. So the sulci are the depressions in between the gyri together, and the gyri are the convolutions. So we can basically say we have ridges and bridges along the superior lateral surface and on the inferior surface and on the medial side of each of the cerebral hemisphere. So we can say that the demarcating point of each of the lobes of the cerebral hemisphere is the sulci. We have what we call the central sulcus, which is basically around this side here, which is from this side downward here. And then we also have what we call the lateral sulcus, which is basically the fissure in between the temporal lobe as well as the parietal lobe here. So we have the lateral sulcus here, and then we also have the central sulcus here. And so the central sulcus, because it is located halfway between the superior lateral surface of both the frontal lobe, the parietal lobe, and the occipital lobe, and that is why it is called central sulcus. So this central sulcus, which is basically here, from here down here, is just anterior to it. This is all what we call the frontal lobe or the anterior lobe of the cerebral hemisphere. Anything behind here, we call it the parietal lobe. And so there's also a demarcating line between the parietal lobe and the occipital lobe here. So by the time you now put this forceps in between the frontal lobe and the temporal lobe here, and this is exactly what we call the lateral sulcus here. Although this brain is a little bit destroyed a little bit, but we can easily see the frontal lobe here, which is, slightly destroyed by the preparation method. So now, if we imagine a vertical line just passing behind the posterior end of the lateral sulcus, we can say that that is the portion of the frontal lobe. Anything anterior to this forceps, we call it the temporal lobe. And anything behind this, if we now do like this, anything behind the temporal lobe and the parietal lobe, anything behind this is what we call the occipital lobe. And so now these are actually the demarcating points between the four lobes that we are talking about. So if you now have a look at the anterior sulcus, central sulcus here, which is the demarcating line between the frontal lobe as well as the parietal lobe. This is the central sulcus here. And so this central sulcus here, anterior to it, we have one large gyrus here. And this large gyrus here is what we call the precentral gyrus. Because it is anterior to the central sulcus, so it is called precentral gyrus, or what we call the motor cortex. So this precentral gyrus, or the motor cortex, is the gyrus that is responsible for all our motor functions, ranging from eye movement, body movement, upper limbs movement, trunk movement, whatever kind of movement that we do on our daily life. And so this motor cortex, or the precentral gyrus, is very much important for our daily activities. So the gyrus behind the central sulcus is what we call the postcentral gyrus. This postcentral gyrus is otherwise known as somatosensory gyrus. The somatosensory gyrus is doing the function directly opposite to that of the motor cortex, which is responsible for all sensations that we sense from our own body, ranging from the pain and temperature, pressure, touch, both the crude touch and also the fine touch and proprioceptions, tactile localization, tactile discrimination, and so on and so forth. So this somatosensory gyrus is responsible for all these our sensations. So all the information coming from our own parts of the body, from the toe down to the head, they all get the input into this postcentral gyrus, or the somatosensory gyrus. So as we are just discussing the gyrus just anterior to the central sulcus, which is this one, this gyrus is what we call the motor cortex, or the precentral gyrus, where the motor cortex is. So anything anterior to this is what we call the premotor gyrus, or the premotor area. So the premotor area is virtually responsible for planning all our movements. Like, say, if you intend to make any movement, like you want to stand up, or you want to walk around, or you want to go anywhere, the planning of movement is responsible, the premotor area is responsible for planning of this movement. Superior and anterior to this premotor area here around this side is what we call the supplementary motor area, which is responsible for our primitive movements. The primitive movements, range from, the kind of movement that animals mostly do, and that is what we refer to as primitive movement. And so, basically, we can see that the frontal lobe, is mainly concerned with our motor activities. And apart from the motor activities, other functions like personality, judgment, emotions, and so many things like that, the frontal lobe is responsible for that functions. If you now take this parietal lobe, basically is mainly for the functions of the sensations in our own body, like we have discussed, the postcentral gyrus, and the human is generally represented, not only humans, even animals, they are all represented on either the postcentral gyrus or the precentral gyrus, what we call the human homunculus, with the representation in an upside down position. So we have the face, downward, and then we have the trunk on the superior lateral aspect here, and then we also have the limbs around this side. And so the genitalia, they are located on the medial side of the motor cortex, on the medial surface of each of the cerebral hemisphere. The same thing goes with the somatosensory cortex or the somatosensory area here. So the homunculus is located in an upside down position where you have the face on this lower aspect of the somatosensory sulcus here, and then we have the trunk and the tomb around this side, and then you have the lower limbs around this side, and then you have the feet and the perineum around this side. So all the sensation from the perineum down to the leg and the feet, the input from that side, they are received from this side. And so that is it for the parietal lobe. When we talk about the occipital lobe, which is this one here, this lobe is primarily responsible for the visual activities. It is mainly for the reception of the images that we always look at when we come out from our homes, and then as soon as we see the images, these other areas in the occipital cortex or in the visual cortex, they analyze the images, and then finally they interpret what we ever see, and then we recognize whatever we see in our own environment. So basically the occipital lobe, which is this one, is mainly for the visual functions. When we talk about the temporal lobe, which is this one here, is mainly responsible for audition. That means the hearing. So all the informations, the noise that we hear in our environment, whatever we like listening to music, listening to Quran, and whatever kind of noise in the environment, the temporal lobe is responsible for that. Apart from responsibility for, the hearing and other things like that, the temporal lobe is also responsible for language comprehension. What do you mean by that? If somebody now speaks, actually one is supposed to understand or comprehend whatever one is talking about. So comprehension of language is mainly the temporal lobe is part of the function of the temporal lobe, whereby whatever one speaks, like your colleagues, your friends, and whatever, once they speak, you will be able to appreciate or understand whatever they talk about, and so the temporal lobe is responsible for doing that. And what I would also emphasize on the motor area here, if we now go back to the frontal lobe, we have to talk about what we call the motor area for the speech. We have what we call motor speech area, which is mainly on the frontal lobe. You see, each of these lobes here, they are basically divided into parts. If you now take the frontal lobe, it's basically divided into three parts by two sulci. We have what we call the superior frontal sulcus, which is this one. And so above the superior frontal sulcus, which is this one, we have what we call superior frontal gyrus, which is this one. And then apart from that, we also have the middle frontal sulcus, which is this one. And so in between the superior frontal sulcus and the inferior frontal sulcus, we have the middle frontal gyrus. And just below the inferior frontal sulcus, we also have what we call the inferior frontal gyrus. So that means the frontal lobe is basically divided into a gyri by two sulci, superior and inferior frontal sulci. And so these three gyri, they are anterior to the motor area that we have already discussed before. And so again, if we now take the inferior frontal gyrus, when you divide it into three parts, anterior 1/3, middle 1/3, and posterior 1/3, that motor area that we are talking about is located on that side. So we call it motor speech area, or what is known as the Broca's speech area. And so whatever we speak, whatever your friend speaks about, you are able to hear that because of this area, is intact. And so if you are able to understand whatever your colleagues speak about, so that is the function of what we call the Wernicke's area that is located in the temporal lobe. And so you'll be able to comprehend whatever your colleagues has talked about. And so temporal lobe, apart from the audition, and it also has the function of language comprehension. So basically these are the functions or major functions of the four lobes. So if we now consider the whole setup of the cerebral hemispheres within the cranium. They're all surrounded by three, membranes. And these membranes, we have the outermost one, which is known as the dura mater, which is basically likely going to be appreciated by, putting this slide here. So we have three meninges covering each of our brains. These meninges, we have the outermost one, what is known as the dura mater. The dura mater is very durable kind of membrane in that it is very tough. Tough in the sense that it is very difficult for one to even tear it, because it's very tough. So it surrounds, the cerebral hemispheres, and it goes in between the two cerebral hemispheres to form what is called, or what is known as falx cerebri. So it demarcates the two cerebral hemispheres together. So the falx cerebri is absent here because the dural sheath, the membrane, is to be removed. Just next to the dura mater is what we call the arachnoid mater. So we have the arachnoid mater that is lying in between the cerebral hemisphere and the dura mater. And so there is another membrane that is directly adherent to the substance of, or to the tissues of the brain itself, or to the cerebral hemispheres themselves. And this is called pia mater. The pia mater is directly adherent to the substance of the brain. And so in between the pia mater and the dura mater, we have the arachnoid mater, which cannot be seen here unless we try to remove some portion of it. Probably we may be able to see some portion of the dura mater here, which you can see it here. I'm just trying to, remove some portion of the arachnoid mater here. And so deep to the arachnoid mater here, I've torn some portion of the arachnoid mater here. And so the arachnoid mater, just below it here, underneath here, you have what we call the cerebrospinal fluid. So the cerebrospinal fluid is the one that is bathing the, the cerebral hemispheres together, as well as the cerebellum all together. And so here, the two membranes, that is the dura mater as well as the arachnoid mater, have been removed. So we only have the pia mater here, and here you can even see some of the, vessels, that are lying, on top of, each of the gyri, in between the gyri themselves. And so these are some of the, dural venous sinuses draining each of the cerebral hemispheres. As we have already discussed in the beginning of this introduction, we said that each of the cerebral hemispheres is linked to each other by a bundle of axons, what you call the corpus callosum. So if I now try to, part these two cerebral hemispheres, we can see some portion of the superior aspect of this, corpus callosum here, which is whitish here by the time we see it here. Basically, what you should also be aware of is that the fixed brain tissue is completely different from the unfixed or new or fresh brain tissue. The fresh brain tissue is very, very soft, and it's very, very delicate for one to handle it. And even the membranes, if you are trying to, to remove them off the brain tissue, is basically difficult. Otherwise, you may likely be tearing off the, the membranes from the unfixed brain tissue. But for these ones that are, already fixed, that is why the brain tissue is a little bit hard and probably easier for one to dissect. Because unfixed brain tissue is basically difficult for one to, dissect it. And so here we can also try to dissect the, the brain tissue. There are basically three, dissection planes where one can dissect, the brain, and so also the small brain, the cerebellum. There are the same three planes that one can use to dissect each one of them. So we have what you call the mid-sagittal plane, which is this one in the sagittal line like this. You can dissect it longitudinally through the corpus callosum, and so you now go down to the brainstem, which we'll see in a couple of minutes. And then again, you can also dissect the brain by using a transverse, plane. These are the two, planes that one can dissect. And again, the third one is where you can use a coronal plane to dissect the brain tissue. And so for the coronal plane, and for the horizontal plane, you can dissect, even including the sagittal plane, you can dissect the brain into different slices for you to be able to appreciate the internal as well as the external structures. So let us just begin by dissecting the cerebral hemispheres into two halves, left and the right half, through the corpus callosum. So we can now, insinuate our knife in this longitudinal fissure in between the two cerebral hemispheres. Remember, in between the two cerebral hemispheres in this longitudinal fissure, we have that fox cerebri, which is completely removed from this specimen. And so here we're able to dissect, we can dissect, the brain into two halves like that. And so we can part the brain like that, and so we can separate it like this, and so that we can see what is present on the medial side of each of the cerebral hemispheres. We can as well also, if we like, we can divide the cerebellum into two for us to be able to see the medial side of each of the cerebellum. And so we can now part, the two cerebral hemispheres together. So here, this is just the medial surface of the cerebral hemisphere here. Here we can see the part of the frontal lobe here. We can see part of the parietal lobe here. And then we can also see part of the medial surface of the occipital lobe here. And so if we now look at this medial side here, we can see the corpus callosum, which has been divided, And so if we look at the anterior side here, we can see that this is, one of the thickest portion of the corpus callosum, and this is what we call the genu of the corpus callosum. And so when you go at the back here, you will see some portion of the corpus callosum here, which is, a little bit, rectangular in shape. And this is what you call the body of the corpus callosum. And then behind here is the disciplinum of the corpus callosum, which is the thickest part of the corpus callosum. And so just anterior to, or just behind the genu of the corpus callosum here, there is a cavity here. If you can see here, I'm just trying to part one whitish membrane-like structure here, and this is what we call the septum pellucidum, which is this one. So this is the septum pellucidum, and this is the cave for the septum pellucidum, whereby it separates it from the, lateral ventricle that we will discuss later on. So we have the cavum of the septum pellucidum here, and this is the septum pellucidum, and this is the cave for the septum pellucidum here, and so we can see the cave here inside. And so when you now open it here, now you can see, if you open the septum pellucidum here, you can see the thalamus. And this is the thalamus here, and you can see the large swelling here, which is the thalamus, and just below the thalamus here is the hypothalamus, which is around this side, this area here. And so between the two thalami is what we call the, third ventricle, because the space between the two thalami is the space that is in communication with the lateral ventricle located within each of the cerebral hemispheres. So we have the space here, just between the two thalami together. And so by mistake, or I can say by design, in trying to cut the two cerebral hemispheres into two halves, here I have cut the connection between the two thalami, which is this portion here. And this is what you call the interthalamic adhesions, that is connecting the two thalami together. And this is part of the commissural fibers connecting the two identical areas between one structure and another structure of different sides. And so below the two, below each of the thalamus is what you call the hypothalamus here. And here we can see the fornix. And this is just a whitish bundle of materials that is coming all the way from the medial side of the temporal lobe and then it passes upwards, just below the thalamus, and then it enters into two swellings that are underneath the cerebral hemisphere, what we call the mammillary bodies. And so the mammillary bodies can be seen here if we part this, if we part the, the interpeduncular fossa here, between the cerebral peduncles coming from above into the, midbrain itself. And so we can see the mammillary bodies, and so we can see them here. So this is part of the optic chiasma here, cut on one side, and so we have the mammillary body, which is this one. So you can see the mammillary body is this one, and then you can see the other one, which is this one here. So they're just small swellings that are lying on the ventral surface of the cerebral hemisphere, lying posterior to the optic chiasma. So we have the optic chiasma here. This is the one of the optic nerve. Some of the parts of the optic nerve crossing to the other side, they form the chiasma here. And so just behind the optic chiasma here, we have the two mammillary bodies here. This is part of the portion of the mammillary body of one side. What I was just trying to cut, this one's supposed to be on the other specimen, and this is the mammillary body of the other side. And so in between the optic chiasma and the mammillary bodies, this place here, this small space here, is what we call the posterior perforated substance, where various branches of the arteries supplying the structures within the cerebral hemisphere, they go in there to supply the brain. So anterior to this optic chiasma, on the medial side of each of the optic chiasma, on either side, we have what we call the anterior perforated substance. And that is also an area where branches of certain arteries supplying the anterior portion of the cerebral hemisphere also go to supply the internal structures of the, of the cerebral hemispheres. So if we now come back to the medial surface here, we can see here on the medial surface here, just above the corpus callosum here, we have one very large gyrus like this. And this is what we call sungulum, or cingulate gyrus. This cingulate gyrus is responsible for our, what we call Papez circuit, because Papez circuit now, connects with the cingulate gyrus, responsible for our episodic memory. And so all the memory that we do have, whether recent memory and even past memory, especially the episodic memory, the responsibility of that is the cingulate gyrus. So we have the cingulate gyrus, connecting with the Papez circuit, and it's also responsible, or is part of our limbic system. We all know that the functions of the limbic system are numerous, which we'll discuss later on in other specimens. And so above the cingulate gyrus here, these are all part of the gyri of either the frontal lobe, the parietal lobe, or the occipital lobe. And so that is that. And so when you come directly below the fornix here, you will see the brain stem. And here you can see the midbrain here. You can see the midbrain here, and then you can see the pons, and then you can see the medulla oblongata down here. And so just behind here, you can see the section of the cerebellum, or the cerebellar hemisphere on one side. And so here, in between the posterior side of the pons and the anterior side of the cerebellum, there is a triangular space here. And this is what we call the fourth ventricle. And so we have the fourth ventricle here. And so if we have a probe that can go above this, you can see that my probe is going in there. And so this is what we call the cerebral aqueduct. The cerebral aqueduct connects the third ventricle with the fourth ventricle through the midbrain. So the midbrain houses the cerebral aqueduct, and also it connects the third ventricle, which is here in between the two thalami, and then it passes through the midbrain into the fourth ventricle. So this is the fourth ventricle here. And on either side of this, if you would now have a look at here, there is one small foramen here going into the lateral side of the cerebral hemisphere. This foramen is what we call the foramen of Luschka. And so this my tip of the scissors, it goes into the foramen here on this side, and then there's another one on either side, on the other side of this section. And so these two foramina of Luschka, they now allow the cerebrospinal fluid to circulate around the spinal cord because it goes down. And then from behind here, there is also another foramen which is called foramen magendi. And so probably we may see some portion, cut portion of the foramen magendi, that, goes around here to bath around the anterior side of the cerebral hemisphere. So we have seen the brainstem consisting of the midbrain, the pons, and the medulla. And so some portion of the medulla here is being cut, and then it continues down with the spinal cord at the level of the upper border of the foramen magnum around the, on the skull. So basically, if we now look at, the inferior side of each of the cerebral hemisphere, we'll see some of the vessels supplying the underneath of each of the cerebral hemisphere from what you call the cycle of Willis. This cycle of Willis, unfortunately, some portion of the vessels coming from, below, lying anterior to the pons, which we can see some portion of it here, and this is what you call the basilar artery. This basilar artery is made up by the unions of two arteries coming from, within the, spinal canal. That is the two vertebral arteries, one from the right side and one from the left side. So they unite at the upper border or at the lower border of the pons to form the basilar artery. This basilar artery, which is here, I can just use my forceps to raise it up here, and this is the basilar artery here. It gives so many branches, about 4 to 5 branches on the ventral side of the pons, which we call the labyrinthine branches. These labyrinthine branches, they go to supply the internal acoustic meatus, and they also supply some, some portion of the pons, what we call the pontine branches. So these, branches coming from the lateral side of the basilar artery, we call them labyrinthine branches and the pontine branches. And so the artery now continues, forward to give what we call the posterior cerebral arteries, supplying the posterior part of the cerebral hemisphere, especially the occipital cortex, which is this one. So this branch, which is this one, the posterior cerebral artery, this is part of it cut. So it comes backward towards the occipital lobe to supply the occipital cortex and the occipital lobe in general. And so, again, anteriorly here, we have internal carotid artery coming from within the skull to become, or to give 2 branches. One anterior branch going to supply the anterior side of, or anterior aspect of the cerebral hemisphere, that is the frontal lobe, and that branch, we call it anterior cerebral artery. And the internal carotid artery now continues at the middle cerebral artery, going around in between the lateral fissure to come and supply the superior lateral surface of the, cerebral hemisphere. And so we have mainly the superior lateral surface of the cerebral hemisphere, including major part of the frontal lobe, major part of the parietal lobe, major part of the temporal lobe, major part of the superior lateral surface of the occipital lobe. All these places have been supplied by the middle cerebral artery, while the remaining periphery of these 4 lobes have been supplied by the corresponding arteries. If you come to the frontal lobe here, the periphery of the frontal lobe is being supplied by the anterior cerebral artery. When you come here now, you talk about the anterior cerebral artery again, and then when you come to the posterior side here, is the rim of the superior lateral surface of the occipital lobe is being supplied by the posterior cerebral artery. And so this junction between the peripheral supply of the cerebral hemisphere with the central supply of the superior lateral surface of the cerebral hemisphere, this is what we call watershed area of arterial supply to the cerebral hemisphere. And it has some clinical relevance whereby if somebody has an arterial blockage, so somebody may likely have, may have a blockage, or if that person has a blockage of any of this arterial supply, so the area being supplied by that artery is definitely going to, be affected. And so basically that is part of the arterial supply. So we also have the two arterial supply, the anterior one, and anterior one on either side, one on the left side, the other one on the right side. They are interconnected by what we call anterior intercommunicating artery. And we also have the two posterior cerebral arteries connecting with the middle cerebral artery to form what we call posterior communicating arteries. Unfortunately, the viewers may not likely see this artery because this brain tissue is poorly preserved. And that is why actually I'm not able to show you this. And probably maybe if we now checked at other specimens, probably we may be able to see them. I'm not so sure about that. So even here, actually, the students, must have, destroyed some of the artery of Willis that I intended to show on this slide. And so, by and large, I think this is, on this specimen, we can see the, part of the lateral ventricle here, and so, and then we have the, the third ventricle here, and then we have this junction here, this foramen here. This is what we call foramen of Morrow. This foramen of Morrow, connects the lateral ventricle with the third ventricle, which is basically located here. And so the third ventricle now communicates with the cerebral aqueduct through the midbrain, the one we have showed in the other specimen. So we have the foramen of Morrow here communicating the lateral ventricle together with the third ventricle here. And so, by and large, this is what I can show here for this. I think probably we have a rest and we continue with the next slide. Thank you.